So good morning again, everyone. My name is Lauren. I'm from the WIPSI team, joined by our team member Mimi, who is managing the chat, which I saw is already really active with good mornings. We're here this morning with the CHOP team to talk about the Clinic Aid program enroll. This will be our third time with this partnership. Great opportunity to work with the clinical staff at CHOP to earn and learn, so that way you can sit for the certified medical assistant exam after earning clinical hours. Again, our session is about an hour, and we're going to talk through all of the expectations and the commitment of the program. If you have any specific questions about your application, Mimi's going to drop the WIPSI email address. You want to send that there. We're going to be talking about the clinic CHOP, the calendar, the expectations. But if you have a specific question about your application, please email us. If you met with Morris before, he'll respond to you timely. We have many interview days set up for everyone to accommodate, so we're really excited about this program. For our agenda today, we're going to talk about WIPSI's work. We're going to do a CHOP and Clinic Aid overview. We're going to talk about the program schedule, the applicant process review, and then we're going to do a quick Q&A with our CHOP team. So a little bit about WIPSI. We go by WIPSI, but our name is the West Philadelphia Skills Initiative. And what we do is that we design and we run programs that connect you to the tools and supports needed to build a career that is meaningful to you. We are a cohort-based training program. One employer, one position. So we're working with CHOP for the Clinic Aid role. One participant for one job opening. So recruitment can be competitive, but once you're in our program, it's definitely a sense of community. We're part of your professional network, preparing you for your interview with the CHOP team. Professional development and coaching. So we'll offer you professional development from emotional intelligence, growth mindset, interviewing tips, and also professional career coaching. We at WIPSI, we engage our employer partners to understand their workplace culture, hiring practices, turnover issues, to build out a customized program and solution that meets their needs. And then, of course, we're going to train and connect Philadelphia residents to this job opportunity at CHOP. All right. Just so you can see some of the numbers we have on the screen, 96% of our successful participants connect to employment, and 83% of our participants retain that employment for 1 year. So if you graduate from our program, we'll still connect with you, and we'll be engaged with our alumni services. So the energy that we bring to our participant relationships, we bring to our employers, vice versa, right? We listen to your pain points as job seekers and we respond to them, and then we create a solution for you, the job seeker. So this is what it looks like. We study employer needs and we study job seeker needs to make matches. We built a customized training program to prepare participants, again, not for the job, but to start a career, to start your career at CHOP. We reach out to the community from email blasts, if you follow us on social media, community-based organizations, any network in Philadelphia that we can connect with, so that way talented individuals like you who joining this session can learn more about our program and contribute to their next employer. And then we make successful matches for you and then for our employer partner. Now let's talk about the Children's Hospital of Philadelphia. CHOP is the nation's first hospital devoted exclusively to the care of children. Open since 1855, CHOP has been the birthplace for countless breakthroughs and firsts in pediatric medicine. Built on a foundation of delivering safe, high-quality, family-centered care, the hospital has fostered medical discoveries and innovations that have improved pediatric healthcare and saved countless children's lives. Today, families facing complex conditions come to CHOP from all over the world. Now let's learn some job highlights about the clinic aide role. The salary for the clinic aide role starts at $17 an hour with CHOP benefits. Applicants will need a high school diploma or GED. As a clinic aide, we go say CAs, you'll interact with children and family members, so customer service is a must. You'll have opportunities to learn the flow of the clinic that you're working in, department roles, and you'll have access to educational models as you move through your career pathway as the clinic aide. Some of your daily tasks will include preparing and cleaning patient rooms before and after visits, restocking items, collecting specimens, completing tasks that are assigned by the certified medical assistants and clinical staff. As a clinic aide, you serve as a runner or a floater so that you can support patients, communicate with other staff, and then support the CMAs. You'll check in with families for status updates or any delays. You'll be a source of communication for patients and their families. By joining the CHOP team, your main goal is to really earn those clinical hours so that way you can sit and become a certified medical assistant, learning closely from the clinical staff at the CHOP sites. Some additional job highlights. Again, it's a part-time role. This is 36 hours per week with CHOP benefits, earning $17 an hour. It's a certified medical assistant career pathway. You want to have customer service experience, high school diploma, GED, also live in Philadelphia for the WIPSI programs, and your schedule will be 7 a.m. to 4 p.m. Monday through Thursday. We like to highlight all of the things about the role so these expectations and commitment fit your life. So we're also now going to talk about some important things you want to know before you move forward with this role. As you can see, it's already in red. Your goal should be to become a medical assistant. The CHOP team has put in a lot of time to really develop a very unique role in order for individuals who join the CHOP team as the clinic aide to move up and move through to learn from the clinical staff, to earn those clinical hours to sit for that medical assistant exam. So this definitely needs to be a goal for you. You want to be compassionate. Patient empathy is a must, right? You'll learn the eye care values that CHOP really hones in on to provide that patient-first care. You want to be computer proficient, right? You're going to learn the software that they use to manage their data on a day-to-day basis, but you want to be able to work around and be confident and comfortable with working and navigating a computer. A solid customer service background, right? Working with others, providing services, working in fast-paced environments, patient care. So if you're doing an application with us, you really want to highlight that professional experience. High school diploma and GED, which you will need for any of WIPSI's programs. And at CHOP, you also want to be tobacco-free as well. Another highlight that we want to spend time on to make sure that you also are keeping in mind, you want to be open to feedback and instruction. In this role, you're going to be learning the CHOP way and how they provide this excellent care to patients and families. So they're going to be showing you ways on how they do things, and they want individuals who are going to take in that feedback and really show up and show out. So you want to definitely be open to feedback and instruction. Now, this slide is really going to answer any questions you have around the commitment that you're going to be making when joining the CHOP team and being a clinic aide. You'll join the team as a clinic aide, supporting medical assistants and patients and clinical staff, right? CAs complete the non-clinical medical assistant tasks, which will then support the entire unit in providing that patient care during visits. After spending some time in that role, learning the eye care values and the day-to-day operations as a clinic aide operating in these different spaces, The leadership team can move you up to the clinical support associates role, right? There you'll spend many, many hours, over 700 to be exact, is strictly preparing for the medical assistant role. You'll have that supervision, providing that direct care. It's a transitional role at CHOP, so you definitely want to make sure if this is the program for you, you move through these proper channels. After completing the coursework, completing that clinic support associates, clinical hours in that role, you'll have the opportunity to register and sit down for that medical assistant exam. You'll have an evaluation throughout this time period working with CHOP, learning things about monitoring vital signs, kind of what the CMAs do, really getting that hands-on experience, opportunity to ask questions, taking feedback, okay? As a clinic aide, that first role, you'll receive this supervised training, you'll get these career exposure experiences, so you can move through these different tracks while you're at the team at CHOP. I'll call out again, your schedule is 36 hours a week, Monday through Thursday, 7 a.m. sharp time slot, okay? So I want to make sure I call out that attendance and what you need, because you're going to be learning some great work when you get to the team at CHOP. Now, here's a program calendar at a glance. Right now, we are actively recruiting. Our application is open. So if you are a caseworker or a case manager on the call, there's still time for your participants to complete an application with us. If you've already applied for our program and you're like Lauren and Mimi, I want to submit a new application, you want to email us at our WIPSI email so we can look at your application to submit a new one. I'll go through the application steps in our next slide, but I like to call that out. If you want to do an application, you want to email us at WIPSI, but there's still time to apply. We end on Tuesday, April 9th, 5 p.m. So end of business, right? There will be some activities that if you move forward in our process, you'll be notified via email for our interviews and next steps. But if you do move through our process, you'll receive an invitation, invite only, for our participant agreement meeting, which will be April 25th with our WIPSI staff, where you'll learn more about the program, learn about the role at CHOP, and all the commitments that everybody is making for you to be successful to join the team at CHOP, from WIPSI, from CHOP, and you. So it's definitely a team effort. Classes will start that Monday, April 29th, 9 a.m. sharp. Our classes will be for 3 weeks, 9 a.m. to 12 p.m. in person at our WIPSI office. Communication, a resume that is working in healthcare spaces, interviewing coaching, again, that career coaching that you'll receive, improv. So we have some different scenarios about some patients and interactions you could possibly have, problem solving, really honing in on a growth mindset. You'll also interview with the CHOP team during that 3 weeks, and then we'll end our program that Friday, May the 17th, with a closing focus group, celebrating your successes, feedback from the program, and then support you as you go through your onboarding coordination with the CHOP team. I'll make sure to go over those numbers, those dates, that calendar again before we end the session as well. So here's the order of operations to submit an application and move through our process. You want to submit an application, you call out your customer patient care experience and why you really want to join this program, any qualifications and transferable skills that you can really bring to the WIPSI and CHOP teams. You want to fully share your work experience and answer all of these questions. Like I shared with you and can't stress enough, we get a lot of work at CHOP. So you want to make sure you're putting the best foot forward and making a great first impression by that application, okay? Again, if you want to resubmit, you want to email us at WIPSI. If you move forward with the role, we'll invite you to come in for an interview day. You'll enter.
Hi, Lauren, you're freezing up there. Sorry, everyone. Bear with us for one moment for the technical difficulty. Oh, I think Lauren got booted out. Give me one moment, everybody. Let me get her back on. Apologize for the inconvenience or the technical difficulties. Bear with us.
I'm not sure where I dropped off at, so I'm going to start over, y'all. So if you hear me repeat, okay. We're working with the rain and internet today. So also in this role, you got to have some flexibility. Okay, first step, you want to submit that application, fully share your work experience. You want to make sure you answer those questions fully. We don't ask for a resume during your app. You really have to tell us why you want to work at CHOP, want to be a medical assistant, really make a great first impression, okay? If you move forward with our process, you will receive an email from WIPSI, so make sure you star us in your email. You'll join us for a WIPSI interview, some assessments to get you ready for our classroom spaces, and also we'll collect some onboarding documents from you. Again, we want to make sure you have these documents. So if you move forward with the CHOP team, you have everything you need to submit so you can start by that start date. We'll have our participant agreement meeting, like I shared previously, invite only. That's where you'll hear more of the expectations of the program, meet the other team members, right? That's going to be in your cohort, and also your first introduction to your new professional network. Then you'll join us for professional development for 3 weeks to prepare you for your interview with CHOP. Again, if you want to resubmit an application, email us at WIPSI. We'll take care of you so that way you can resubmit. If you feel as though you didn't give the best, great first impression to represent your experience, okay? We do have that opportunity for you, just have to let us know. All right. So I'm going to actually end. Hold on, let me pull up my screen. It should just be me now. All right, slide deck's off. I did see Maria. I saw her face join us right now. We're going to do a quick Q&A. So if there's any questions, you can drop them in the chat. I'm on mute too. So we want to do a quick Q&A right now. Thank you again, Mimi, for dropping those key dates in the chat, just to make sure everybody can keep everything, because a lot of information that's happening. If you do submit an application, you'll also get those key dates in writing as well. Oh, Miss Jonelle is here as well. I'm going to kick us off with some Q&A. We have some great team members at CHOP. I've been working with them for the last few years, so you will all be in good hands. Just in case there's some nervousness, let me kick off the first question that we have, right? So for Maria and Jonelle, can you share with us what does it take to be successful at CHOP being a clinic aide?
I'll get started if that's okay. Can you hear me okay?
Yes,
Thank you all. It's really a pleasure to join you, and I'm very happy to see all of these names. We're very proud of our Clinic Aid program, and just to save on time, I'm going to address what does it take to be successful as a Clinic Aid. I think we talked a little bit about when the behaviors that were outlined or the attributes that were outlined at the very beginning of the presentation. Flexibility is one of the key elements, key properties that you need to bring to this role. Every year that we do this, and with every cohort, we find different ways or improve ways to do this, and we need you to be flexible, because ultimately what we're trying to do is create a very successful person career, clinic aide, medical assistant. Be patient with yourself. I think it's another one. When you tend to get this job, there is a perception that the quicker you move, the sooner you will become a medical assistant. There are a lot of things that go into being ready to be a medical assistant, and you need to work at a slow pace, at the pace that this was designed, so that you can pick up all of these behaviors. Keep in mind that a lot of people become medical assistants after going to school 6 months to a year, and they get a very rigid curriculum. They get exposure to the clinical environment. They learn a lot of technical language. They learn how to use, how to work in that environment. That is something that we're trying to teach you at the same time that you're working. So it's going to take longer, and it depends a lot on what your background is. So being patient with yourself, being patient with each other, and receiving feedback, being open to that feedback, that constructive feedback as to how you can do things better is critically important. Those previous clinic aides that have successfully become medical assistant, and it's most of them, I have to tell you, it is most of the group. They have been patient with themselves, and they have avoided the temptation to jump ahead and do things that are out of their scope, or not part of what has been approved of them to do by Janelle and her team, or by the certified medical assistant that's working with you. Okay, so that's critically important. I want to make sure that I stress this piece. We have had some candidates of our Clinic Aide program choose to leave because they think they can move ahead someplace else, and then try to come back. As Lauren stated earlier, the clinical support associate job, which is the interim step between being a clinical assistant and being a certified medical assistant, is an internal job only, and it's only open to individuals that are on the pathway program. So if you leave while you're a clinic aide and get a similar job somewhere else, and then try to come back as a clinical support associate, you can. You will have to go through your whole certification process, including having transcripts from a medical assistant school before you can come back. So we want to make sure that when you join us, you understand that this is a pathway program, and it has key steps that need to be met in that time frame. So I'm happy to answer those questions if you have questions around that. But just to answer your question, what does it take to be successful? Again, being flexible, being receptive to feedback, paying attention to those professional behaviors of courtesy, punctuality, and attendance. We can't afford you to miss clinical hours, because if you miss clinical hours, even if it's 30 minutes here, 30 minutes there, that's going to keep delaying the amount, your progress through the process. And we can't run clinics if we don't have the support we need when we need it, when patients are here. Okay, thank you. Janelle, you have anything to add?
Thank you so much, Maria.
Hi, everyone. The only thing I was going to add that I say will make you successful is having accountability and integrity. People have a habit of coming here and picking up the bad habits of everyone else after even learning what those rules are or learning the right way to do it. And I always review everything with everybody on how to properly do something. So consistently staying with that integrity and, following those rules is absolutely important to your success, as well as being accountable that when you receive that feedback, you're open to saying, okay, I made that mistake. How can I correct it? So that's the two things I would add to what Maria said.
Yeah. Thank you for that. Really preparing folks to be successful in the role. I see one question came in. Someone is asking, on average, how long does it take for individuals in the clinic aide position to transition to become, I'm going to say in the clinic aide position to transition to that unique role, the CSA?
Support associate.
Mm-hmm.
It's about 1,000 hours. And again, that all depends on your attendance, your punctuality, your willingness to do what you need to do, and then to learn what you need to learn. The clinical hours are separate. We now have, and Janelle can speak more to this, we now have 4 hours of classroom that happen every Friday. Those hours are excluded from the clinical hours. It has to be hands-on, clinical hours in the clinic, being exposed to the clinical environment, listening to the terminology, working with the MA, learning the clinic. So when you think that a full-time job is a full-time assignment is 2,080 hours. If you're working 0.6 in the clinical environment, it's going to take you close to a year to complete that clinic aid role. Because you take time off, you have a sick day, you have vacation time, it's going to take you about a year. Right, Janelle, would you say that's about right?
Yes, that's correct. And a year is best because, especially depending on your background, you want to have that year as the clinic aide before you even transition over to that clinical support associate. Because once you transition to that position, you're not necessarily on your own, but you're kind of on your own. So I like to make sure that you had that experience and you had that training before you even hit that position.
Great, thank you. And I'll ask one more question before I open it up. And I think you've already covered kind of the difficult parts and how the CHOP team supports everything from those additional educational opportunities, ask questions, really take your time to take in and hone in on this work. Can you share with us kind of what will it look like when we first start as a clinic aide in CHOP, some of those activities that we would be doing?
Do you want to handle that, Janelle?
Mm-hmm. So when you guys would first start, it always starts off with orientation, of course. That would be me. That would be me primarily going over the policies we have here, the rules, how we do things. And then once you are placed inside your clinics, you'll learn how the clinic works, how they stock, how they go about bringing their patients back. You'll learn about Epic. And then it kind of just like baby steps from there. The intention this time that we didn't do last time is that we'll start the classes right away. So once you come in, I believe me and Tiffany discussed that we'll start the classes about 2 weeks in after you guys started. So once you've like been acclimated, at least with Epic and everything else, 2 weeks in, we'll start the classes with you guys that Friday. And then on the classes, it's kind of just going over the MA curriculum in a whole. So it's like Maria said, having school while also working, just to make sure you guys get that education and that you're familiar with the language you're going to hear when you're on the floors and you feel more comfortable to answer questions or speak to the providers and speak to the nurses as well as the medical assistants.
Thank you for that, Janelle. Your team always is really intentional about making sure you bring on successful clinic aides. So it's always a pleasure working with y'all. I'm gonna have a few questions from the chat, some for Lipsy, some for CHOP. So I'll try to triage where we go. Someone asked, how many people are we looking to hire? So we have about 12 openings, right? So again, the recruitment process is really competitive, but once you're in the cohort, we're all now part of your professional network, and our CHOP team has committed to interview the individuals who are in our cohort. Hold on, I'm going through now. I think someone asked, here we go. I already did an application. How do I know I applied correctly? If you submitted an application, you should have received a thank you email for submitting your application. If you have a direct question about your application and status, send us an email, right? So that way application and can respond to you timely. See in your email, once you join our cohort, we'll tell you to start a CHOP team as well to make sure you don't miss any information or communications coming in. And hold on, I'm going through. Someone asked, do you need the booster for the COVID to start? Now, I know you need to be fully vaccinated. From my understanding, the booster wasn't required.
No, it was a 3-series. Oh, sorry, I don't know my feedback. The 3 series for Moderna, like the same as the initial program. No, you don't need an additional annual, but you do need the flu vaccine. That's mandatory.
Right. So just the 2 doses to be fully COVID vaccinated, but you also need the flu vaccine as well.
Right.
And if you work for any health providers, that's yeah. Thank you for that, Maria.
It's very, very difficult in case you're trying to get any kind of religious exception or exemption. Like we really don't. I mean, this is children, and we have a lot of immune compromised children. So it's unlikely that you would be able to get any kind of exception for that.
Yeah. And Maria, for our program to move through this process successfully, when they do exemption.
You keep freezing, Lauren. I'm sorry.
Y'all, the internet's not on my side.
No, I think I'll be
Am I
happy
okay
to-
now?
Yeah, you're good right now. I
Okay.
think I'm gonna shut off my camera. That sometimes helps with the bandwidth, so everybody's still on my
Oh,
face, and I'll
no.
just turn it off just so in case
I'm
it's my side.
freezing. No.
But I'm here. You can still hear me, right?
Yes, I can still hear
Yes, we
you,
can still hear you,
Maria.
Maria.
Okay, sounds good. I guess, I don't know if Lauren can hear us or if she's able to speak, but there is a question that I do want to make sure that it's answered from Tiara, who asked, is it possible for certain individuals with previous medical background to be able to expedite the program? I would say as a general rule, no. Our program is very structured. The way that we are allowing you or providing you the opportunity to take the medical exam, the medical assistant exam without a transcript from a school is by attestation of your clinical hours, the actual clinical hours. And we're taking on that responsibility to attest to those clinical hours. Unless you can have attestation from other employers, I don't see how that would happen. And our, we're attesting to the clinical hours in our environment only. We cannot attest to previous experience.
Mhm.
The thing that I can say is you probably would be very successful in meeting if you have a lot of experience in the background to move through the program effectively and kind of stick to those 1,000 hours instead of going 1,500 or more. But happy to discuss your individual case and see what you have available to you. I think one of the things is if you don't join the pathway program with us, we actually require school transcripts to enter as a certified medical assistant. So that's one of the challenges that many people have with so many of the schools having closed down.
Maria,
Thank
I'm gonna.
Go ahead.
Oh, I'm sorry, Lauren. I didn't know you were back.
I made it back. I appreciate everybody's patience. Go ahead, Mimi.
And I was gonna help ask some of the questions for you.
Okay, great. Yeah.
Just to let everybody know, we're going to share this recording session with everybody after this session, after this meeting. So for those who are asking about dates and times, it'll be included in the follow-up email. The one question that came up is this program for someone who have no previous medical background experience?
I think we have a fair balance of both. I think that if you have a background in, let me tell you, I think the hardest things for anyone in a medical environment to learn is not so much the clinical task, it's the culture, right?
Mhm.
It's the culture of working with patients and families, the family-centered care approach, the communication, working with providers. One of the things that has come up, a lot of people have come in to my office and said, how do I talk back to a provider? And the answer is you don't talk back to a provider, you communicate with a provider. So there are things that if you have background in the medical field, in healthcare, you kind of have learned. And that's all those communications, there's a lot of the terminology, those kind of things. So I think people who have that background have an easier time of learning the role and learning the culture, not necessarily the skills that we need for this clinic and particularly for pediatrics. So it's a little bit of both. It really is about your willingness to learn. Previous background and experience hasn't been a significant asset here. I think what really is your willingness to work and your willingness to learn and your professionalism, how you communicate, how you carry yourself, how you dress, how you present yourself, how you accept feedback and communication, and particularly attendance and punctuality. Please, kind of have your ducks in a row. Make sure you have a support system for childcare, for any kind of medical needs. You will not be eligible for a what they call an FMLA for over 6 months because it's based on hours. And I think that there's a misconception when people arrive that because it's a benefit eligible position that you would have FMLA or disability benefits. Those do not accrue right away. Those you're not eligible for until you have worked a significant number of hours. And it's close to that 1 year. So because of the number of hours. So just be aware of that those supporting, protecting your time with a disability or an FMLA is not an option when you first start.
Thank you for that, Maria.
Thank you. Janelle, would you say the same thing about prior clinical experience as far as
Yes. Yeah, I was going to say that it can
Mhm.
be helpful, but we have people who started who didn't have a lot of the background and they still did amazing. They still learned really well.
So
They were open
thriving.
to the feedback. So it can go either way.
That's great. I'll jump in really quickly because I see some comments in the chat just going over the key dates of the program. Again, recruitment ends on April the 9th, 5 p.m. to submit an application. You'll receive an email from us thanking you for submitting your application. And if you move forward in the process, it will be an invitation to our interview days here at WIPSI. And then if you move through our interview process, we'll share more details with you. And if we invite you to the program, it'll be at our WIPSI site, April 25th, 9 a.m. sharp. Classes will start Monday, April 29th, 9 a.m. sharp, Monday through Friday for 3 weeks, 9 a.m. to 12 p.m., ending on Friday, May the 17th. So that way you know the full calendar, but you'll get all of those details as well. Someone shared, if you haven't received a response back, you want to make sure you email the WIPSI team so we can give you a status update. And Mimi has dropped that in the channel. Anytime you have any questions, even if questions come up after this process, email that WIPSI email address. Someone from our team will definitely get back to you right away. Marie is active in the chat, answering questions. Thank you so much. All right. So I think we're going to end this session right now. I know we gave a lot of information. Let me do my thank yous, of course. Thank you to Maria and Janelle and the CHOP team for creating such a unique role to bring in certified medical assistants, starting out as being a clinic aide, committing to the role, and sharing your values and expertise with our next set of 12 applicants and graduates already putting in the air to join your team. I want to thank everybody that's on this call, from providers to potential applicants. You already have a leg up in really hearing from the leadership team at CHOP, the desires of the role, the expectations, right? So you're in a good place. If you have any questions about your application, email us at WIPSI so that way we can look at your application, really review so we can answer your question thoughtfully and give you any support that you need. Mimi dropped again where our application is at. When you look at that application, we share with you all the information first. Click that apply now to apply. Make sure you make a great first impression. Thank you so much for joining us this morning. Thank you for being impatient with the connection in my internet. And it was a pleasure talking to everyone. And good luck with the rest of this process. Take care.
Thank you all.
All right. Thank you,
Thank
everyone.
you. Thank you again.